Good morning, I'm Vic Senese, and this is UroNurse News. Be sure to like and subscribe. Today, an important update coming out of the 2026 World Congress of Nephrology in Yokohama, Japan, where investigators presented new mechanistic and clinical evidence suggesting that semaglutide may have direct protective effects on the kidneys, independent of baseline chronic kidney disease severity. Now, this is not just about glucose control anymore. It's about kidney biology itself. At the center of this discussion is the REMODEL randomized trial, which explored how 1 year of semaglutide therapy, 1 milligram once weekly, versus placebo affects kidney structure and function. Researchers used advanced tools including functional MRI, kidney biopsy analysis, and transcriptomic profiling. And the findings were striking. Functional MRI demonstrated reduced fat accumulation in and around the kidneys, lower renal arterial resistance, and stabilization of cortical fibrosis. On microscopic level, kidney biopsies revealed fewer inflammatory immune cells, especially the natural killer cells and the natural killer T cells surrounding the glomeruli. Even more importantly, transcriptomic analysis showed that glomerular endothelial cells were the most responsive to semaglutide. These cells showed improved metabolic function, reduced fibroinflammation, and early signs of structural repair. Researchers also noted increased expression of cadherin 5, a marker suggesting restoration of the glomerular filtration barrier. In other words, the kidney's filtering system may actually be healing at a cellular level. Now, a post hoc analysis from REMODEL also suggested that semaglutide's kidney benefits appear regardless of SGLT2 inhibitor used in patients with type 2 diabetes and chronic kidney disease. This suggests a potential independent pathway of renal protection. Now, turning to the FLOW trial, which included more than 3,500 patients with type 2 diabetes and varying stages of chronic kidney disease, participants were stratified by eGFR levels and albuminuria categories. Across nearly all subgroups, semaglutide reduced the risk of composite kidney outcome that included kidney failure, a sustained 50% decline in eGFR, and kidney or cardiovascular death. That's across most groups. Now, benefits were observed across kidney function levels for a GFR above 60, 45 to under 60, and 30 to under 45, and even below 30 mils per minute per 1.73 meters squared. While effect size varied, the overall trend consistently favored semaglutide. Similar patterns were also seen across urinary albumin to creatinine ratio categories, including mild albuminuria, moderate disease, and severe proteinuria above 2,000 milligrams. In the highest risk group, patients with a UACR over 2,000 milligrams per gram, the kidney protective effect was particularly notable. According to Dr. Catherine Tuttle, who helped moderate the session, these findings support the use of semaglutide in preserving life, particularly in patients with advanced diabetic kidney disease. She also noted that the strongest signals may be in high albuminuria and advanced reductions in kidney function. It's important to note that both the FLOW and REMODEL trials were supported by industry funding, and full disclosures are available in the published literature. The results were published in the Clinical Journal of American Society of Nephrology. What we are seeing here is a shift in how we understand semaglutide, not just as a metabolic drug, but potentially as a multi-system protective therapy with direct renal effects. More research is still needed, but the direction is clear. Kidney protection may be part of the mechanism. Tonight, on Dr. Jeff Talks About Sex and Intimacy, Dr. Jeff sits down with relationship coach and educator Monica Tanner for a powerful, eye-opening conversation that challenges what many of us have been told about marriage. Together they unpack the most common myths couples hear, those just communicate more or always compromise type of message, and explain why they often fail in real relationships. More importantly, they share what it actually works. Practical, evidence-informed strategies that help couples improve communication, rebuild trust, and deepen intimacy in ways that hold up in real life, not just in theories. If you've ever felt stuck in your relationship, despite doing all the right things, this episode will change how you think about connection, conflict, and closeness. So, drjeffsextalk.com, tune in tonight at 7 p.m., and we'll take a quick look at that with you. Now, tomorrow on UroNurse News, got that stubborn elbow pain that won't go away, or sharp heel pain every morning when you step out of bed? Tomorrow, I'm diving into a treatment that's changing how clinicians approach chronic tendon pain. Shockwave therapy. There's another thing that's being used for everything. Could sound waves actually help heal damaged tissue? Is this the breakthrough patients have been waiting for? And who is the best candidate for this non-invasive therapy? Tomorrow, we're going to break it all down, the science, the results, and what you need to know before trying it.
UroNurse News every weekday at 9 a.m. Central Time.